Hello, my name is Jacob, and my presentation is on the gastrointestinal system, which is also commonly referred to as the digestive system. So the gastrointestinal system's main function is to provide the human body with nutrients for cell replication and the development of new tissues. This is done through the process of 4 different stages. It all starts with ingestion, which is eating, chewing, and swallowing. The next stage is digestion, which is the breakdown of food that we've just eaten. After digestion is absorption, which is where all the nutrients that our body needs to thrive are absorbed by the small intestine. Finally, we come to the elimination stage, which is where our body gets rid of waste products through defecation in the form of feces. So food enters our body through our mouth or oral cavity and is broken down through the process of mastication or chewing. The food in our mouth gets lubricated by salivary glands, which produce saliva. Saliva helps us chew and swallow while also assisting in the breakdown of starches as soon as they touch our mouth. After chewing and breaking down the food, it is then swallowed and goes down the esophagus. The food that has been all chewed up and moistened is called a bolus. The esophagus is lined with a layer of mucus, which helps the bolus make its way to the stomach. Before the bolus can pass into the stomach, it goes through a sphincter. This sphincter surprisingly has 3 names, which include the lower esophageal sphincter, the gastroesophageal sphincter, and the cardiac sphincter. Once the food enters the stomach, this is where the digestion stage begins. The stomach has 3 main sections to it, which include the fundus, which is the top part of the stomach, the body, which is the central part of the stomach, and the pylorus, which is a muscle that sits right between our stomach and the entrance to the small intestine. The stomach's job is to store and break down all the food that comes down the esophagus. The stomach is filled with hydrochloric acid and other gastric juices which help to break down the food. Our stomach is coated with a thick layer of mucus to keep the hydrochloric acid from eating away at our stomach. So once the food has been broken down and mixed with all these gastric juices, it becomes a substance which we call chyme. It is then the job of the pyloric sphincter to slowly release bits of chyme into our small intestine throughout the day. This is where digestion ends and absorption begins. When the pyloric sphincter opens, the chyme is released into the first part of the small intestine, which is known as the duodenum. The second and third parts of the small intestine are called the jejunum and the ileum. The total length of all 3 is around 20 feet. The small intestine has multiple folds throughout, which are called plicae. The plicae contain villi, and these villi contain blood capillaries. These blood capillaries will absorb the proteins and carbohydrates from the chyme. The villi also contain very important lymphatic vessels. These vessels are called lacteals. The lacteals are responsible for absorbing any lipids from the chyme. Lipids are essentially fat. The absorption stage ends at the ileum, and the elimination stage will then begin in the large intestine. So compared to the small intestine, the large intestine is much smaller in length, but much wider. The large intestine is only about 5 feet in length, compared to the 20 feet of the small intestine. However, the large intestine is still very important. This is where the elimination of waste products occur. Some vitamins are taken into the large intestine, but mainly it specializes in the elimination of waste rather than absorption. The ileocecal is where the small intestines connect to the colon, and the large intestine begins with the cecum, and connected to it is the vermiform appendix. The appendix does not have a function in the digestive system, but contrary to popular belief, it is not totally useless and does in fact play a small part in the lymphatic system. At this point, the chyme is no longer called chyme. It is called feces. In the process of elimination, the feces will travel from the cecum to the ascending colon, transverse colon, descending colon, and sigmoid colon. The final resting place for the feces is within the rectum. The feces are released through the anus. This is referred to as defecation, and another term for this is bowel movement or BM. So here are some pathologies of the gastrointestinal system. Starting at the top, we have gingivitis. Gingivo means gums, and itis is the inflammation of. So gingivitis is a disease which inflames the gums, and it can be noticed that the gums are very red or swollen or bleeding. Next, we have cirrhosis, which is another disease that can occur within the GI system. Cirrho means orange or yellow, and osis means an abnormal condition. So cirrhosis is a chronic degenerative disease of the liver. This can be caused by a variety of different things, but some of the more common causes include chronic liver disease or the abuse of alcohol. And as you can see on the right-hand side of the slide, I've included a picture to show the difference between a normal liver and a liver that has been affected by cirrhosis. So next we have cholecystectomy, which is an operation where the gallbladder is removed. So cholecysto means gallbladder, and ectomy is the surgical removal of. So, and this procedure was actually done a few years back by my mom when she had gallstones. Next, we have hematochezia, which is the passing of bloody stool. Hemato means blood, and chezia is the condition of stool. This can happen if there's bleeding happening in the distal colon or even the rectum. So when the feces pass out, they're all bloody. And that is the end of my presentation. Thank you so much for watching, and I hope you enjoyed.